Right, so this is your rectus abdominis muscle. It's a long strap muscle on the anterior abdominal wall. It's going to extend from the region of the symphysis pubis, going superiorly, where it's going to be wide above than it is below. It arises by two heads, a medial head and a lateral head. So you have a medial head, which comes from the pubic symphysis, to be more precise, you say the anterior surface of the pubic symphysis. Then you're going to have a lateral head, which comes from the lateral part of your pubic crest and sometimes the pubic tubercle. But in terms of its insertion, it's going to insert in this region, as you can see. It's going to insert into the fifth, the sixth, and the seventh costal cartilages. So you'd rather say the seventh, sixth, and fifth costal cartilages. And its nerve supply, just like the other muscles on the anterior abdominal wall, it's going to get its nerve supply from the lower six thoracic nerves, but it's not going to receive innervation from the L1 nerves, your ilioinguinal, iliohypogastric, because they don't pierce the rectus sheath. Speaking of which, the rectus sheath is going to be the covering of this rectus abdominis muscle. It's going to be derived from the aponeurosis of the anterolateral muscles of the anterior abdominal wall, which is going to be the external oblique, internal oblique, and the transverse abdominis. This rectus sheath can be viewed at three different levels. There's one above the costal margin here, where the anterior wall is formed by the external oblique aponeurosis, then the posterior wall is formed by the insertion, which is going to be the fifth, sixth, and seventh costal cartilages. Then between the costal margin and the aces here, where you have the acute line, you're going to have anteriorly the external oblique aponeurosis plus a divided part of the internal oblique aponeurosis. Then posteriorly, you have the internal oblique aponeurosis as well as the transverse abdominis. Then below that ACEs or beyond this acute line, that's where you're going to have all three layers passing anteriorly. Function-wise, this is going to flex the trunk on the pelvis. It's also going to be an accessory muscle of expiration, and it's also going to help with compression of abdominal contents. So other things that you expect to find within the rectus sheath, you can have the inferior epigastric arteries passing through the arcuate line. Remember, it's coming from the external iliac before it goes on to become the femoral artery. You can also see the superior epigastric arteries. Remember, it's one of the terminal branches of your internal thoracic artery in the sixth intercostal space. Then you also have the corresponding veins. Then you have the nerves that I've talked about, which is simply going to be your lower six thoracic nerves, or you can say the lower five intercostal nerves plus the subcostal nerves, whichever way you want. Then we have this tendinous intermuscular sections that we also see that help us see that the rectus abdominis, right? So these tendinous intersections, they pass horizontally, as you can see. Sometimes they do it in a zigzag manner, and they help divide your long muscle into shorter segments, which is sometimes referred to as what we call the six pack.